Phases/steps of nursing process. The nursing process has 5 phases: assessment, diagnosis, planning, implementation, evaluation. Nursing assessment. Nursing assessment is the first step in the nursing process. In this step, nurse systematically collects, verifies, analyses and communicates data about a client's health status. Definition. According to Gorden, 1987, assessment refers to the collection and interpretation of clinical information. It focuses on gathering the data about a client's state of wellness, functional ability, physical status, strengths, and responses to actual and potential health problems. It is a deliberate, systematic, and logical collection of subjective and objective data that are helpful to identify and define problems of the client, before the nurse proceeds to plan the care. A comprehensive assessment is holistic and includes physical examination, health history, psychological, sociocultural, and emotional and spiritual factors that affect the client's health. Nursing assessment v/s medical assessment. Nursing assessment focuses on the client's health status and responses to illness, whereas medical assessment focuses on the pathology underlying illness. Nursing assessment is carried out by nurse while medical assessment is done by the doctor. Purpose of assessment. Gather data about the client, individual, family or community. Use the data for diagnosing, identifying outcomes, planning, and implementing care. Gather baseline information about the client. Identify the client's health status and the ability to manage the problems and need for nursing care. Decide about the client's risk for dysfunctions and presence of any dysfunctions. Identify client's strengths based on which to plan individualized holistic care. Bring about positive changes in the client's health status. Provide data for diagnosis. Types of assessment. Initial/comprehensive assessment. Focus/ongoing assessment. Emergency assessment. Time-lapsed assessment. Initial assessment. It is the assessment done within specified time after admission to a healthcare agency. This assessment is done as soon as client came to hospital and is very comprehensive. It gathers data considering all aspects of the client's health. It is a basis for ongoing nursing assessment. It gives baseline data which is very crucial to evaluate the changes in client's health status in subsequent assessments. Focus assessment. This is daily assessment of admitted client done by nursing personnel. It is an ongoing process integrated with nursing care. It helps in determining the status of specific problem identified in initial assessment. In this assessment, nurse may identify new/overlooked problems or misdiagnosed problem. Focus assessment concentrates on collecting data about a problem already identified. Nurse daily evaluates the status of identifying problem, whether it is improved or deteriorated. E.g., nurse is looking after a head injury patient. Her focus will be on GCS scale. Emergency assessment. Emergency assessment is done if client has suddenly developed physiologic or psychological crisis. It helps to identify life-threatening problems. The focus is on preserving the life. E.g., sudden BP fall, airway obstruction, unconscious, patient has suicidal thoughts. Time-lapsed assessment. This assessment is done several weeks/months after initial assessment. It helps in comparing the client's current health status from the baseline data similar to focus assessment. It also evaluates the status of problem already identified. E.g., assessment is done as patient came for follow-up. This type of assessment is less comprehensive. Components of assessment. Collecting data. Organizing data. Validating data. Recording data. Collecting data. Data collection is the process of gathering information about client's health status. It includes physical examination, health history, psychological, sociocultural, and emotional and spiritual factors that affect the client's health. Data should include past history as well as present complaints. Types of patient data. Subjective data. Objective data. Subjective data are information from the client's point of view, symptoms, including feelings, perceptions, and concerns obtained through interviews. Objective data are observable and measurable data, signs, obtained through observation, physical examination, and laboratory and diagnostic testing. Sources of data. Primary sources, client. Client is the best source of information unless he is too ill, confused. He provides subjective data. He provides most accurate information about healthcare needs, lifestyle patterns, present and past illness, perception of symptoms. Secondary sources, family members, healthcare team, records, books. Family and significant others who knows the client well can supplement information about client. They are the primary source of information for infants, critically ill, mentally handicapped and unconscious client. Healthcare team is a potential source of information. They can identify and communicate data as well as verify information from other sources. Records, medical records, past health pattern, immunization, records of therapies by other health professionals, laboratory records etc. provides as well as can verify the information. Review of books and keeping up-to-date knowledge is very important for nurse as it provides additional information. Method of data collection. Observation. Interviewing. Laboratory data. Physical examination. Techniques of physical examination. Inspection. Palpation. Percussion. Auscultation. Manipulation. Organizing data. In order to obtain data systematically, a professional nurse uses an organized assessment framework. Many frameworks are available for the systematic collection and documentation of assessment data. Mostly nursing institutes have developed their own frameworks after taking guidelines from nursing theories. E.g., Gorden's typology of 11, nursing functional health pattern, Roy's adaptation model. Framework helps to prevent the omission of pertinent information and enhances data analysis in diagnostic phase. These frameworks can be modified based on client's physical status, nurse's own preferences. Nurse should have thorough knowledge of the model based upon which she develops framework for organizing data. Validating data. In simple words, validation means cross-checking the collected information. Making sure that the collected information is factual or true. It is the process of confirming the accuracy of assessment data collected. While collecting data, nurse gets many cues and inferences. Validation assists nurse in clarifying the accuracy of cues and inferences. Incorrect cues and inferences may lead to development of inappropriate nursing diagnosis. In order to identify relevant cues and correct inferences, nurse must have up-to-date clinical knowledge, assessment skill, and experience. Validation of collected data can be done by following. Recheck the collected data, e.g. checking pulse from all pulses, measuring BP from other side, confirm the subjective through objective data. Ask some other expert, professional to collect the same data. E.g., while grading the pressure ulcer, you may consult physician or other experienced nurse. Recheck data which is extremely abnormal, e.g. measure the body weight of obese infant using via 2 different scales. Clarify client's statements by sharing observations with client, family members. Clarify any ambiguous or vague statements. Use references such as textbooks, journals, research studies to enhance knowledge and skill. Recording data. To complete the assessment phase of nursing process, recording/documentation is very important. Recording of the collected data should be done systematically. It can be done either on the assessment record or computerized assessment record depending upon hospital policies. If a standardized admission form with assessment performa is available in a hospital, it saves times and energy by helping the nurse to write only the information. Nurse must make sure that the documentation is accessible, understandable, complete, and legible. This assessment data becomes a medical record accurate, which can be used legally.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.